So let's try to understand tetralogy of Fallot with the help of this really simple line diagram, and it's going to become very easy after this, trust me. So there are 4 defects occurring congenitally in this baby. So what is occurring is there is an overriding of the aorta. What does this mean? It means that the aorta, which is normally going to open elsewhere, is now opening right here near this ventricular septal defect. So the blood which is deoxygenated in the right ventricle is going to jump directly into the aorta and can be pumped for the rest of the body easily, right? And then there is a subpulmonic stenosis here. Now every time there is a subpulmonic stenosis, the right ventricle has to put excess pressure to pump through it, and it's going to become hypertrophied, right? So now if we go back to a bit of the basics, we know that the left side of the heart normally is more pressure, right? It's a high pressure system because it is pumping to the rest of the body. But over here, what is happening in this baby is that because of this right ventricular hypertrophy here, the pressure system is reversed. The right ventricle becomes more pressure than the left ventricle, so it essentially pushes more of this deoxygenated blood into the systemic circulation with ease, because this is now a high pressure system. So that is the real problem here, and that is going to cause this cyanosis in this baby, which is the main problem. So essentially this baby is cooked at this point because it is going to have all of these complications occurring in sequence. And let's try to understand what these are. Is first, there is hypoxia, right? If there is cyanosis, then there is hypoxia. So if there is hypoxia, there will be an increase in RBC mass as compensation, and that is called as polycythemia. If there is polycythemia, that is going to increase the viscosity of the blood, which means it is going to have increased risk of thromboembolism. And as usual, the right side of the heart is congested because of this stenosis. Now if there is congestion, then that means there is infection. If there is infection and the blood is easily getting to push through the systemic circulation, the infection can easily travel from the right side of the heart, bypass the lungs, and it will directly reach the systemic circulation and can reach the brain, causing a brain abscess. And the next complication is a hypercyanotic spell, which I will explain to you in the next video in a simple manner. So subscribe and stay tuned.